ever find yourself stuck in the middle of the sea, I'll sail the world to find you. If you ever find yourself lost in the dark and you can't see, I'll be the light to guide you. Find out what we're made of when we are called to help our friends in need. You can count on me like 1, 2, 3, I'll be there. And I know when I need it, I can count on you like 4.
Cranial nerve number 1. Checking your sense of smell. To evaluate the patency of the nasal passages bilaterally, you can see that the patient breathes through their nose. They can evaluate a good sense of smell and a foul-smelling odor. Cranial nerve number 2. Checking visual acuity, visual fields, and ocular fundi. First, in checking for visual acuity, you will be needing a visual acuity chart or a Snellen's chart. You will let a patient read the letters from 20 meters away. After, you will ask them to cover one eye and read the lowest line on the chart as possible and do the same on the other eye. Then you can note the visual acuity for each eye. Next is to evaluate the visual fields via confrontation. Face the patient 1 foot away at the eye level. Instruct the patient to remain looking at you in the eyes, and then now the examiner will test if patient can see hands on this side, and this can check for the peripheral vision. Next is to use ophthalmoscope. Cranial nerve number 3, checking for pupillary reaction. Ask the patient to focus an object in the distance and observe the diameter of the pupils. Note the symmetry between pupils. And next, shine pen light into one eye at a time and check both the direct and concentric light response in each pupil. This is done to note the pupil size and possible asymmetry. Some conditions can be ptosis, anisocoria, nystagmus, and many more. Cranial nerves 3, 4, and 6. This is to check the eye muscle and other muscle movements. This is done by asking the patient to keep their head perfectly still directly in front of you. You should draw 2 large joining H in front of them using your finger and ask them to follow your fingers with their eyes. It is important that the patient does not move their head. Any problems affecting these cranial nerves means that there is nerve problems. Trigeminal involves sensory supply to the face and motor to the muscles of mastication. There are 3 sensory branches of trigeminal nerves. These are ophthalmic, maxillary, and mandibular. Initially, test sensory branches by lightly touching the face with a piece of cotton wool and also with a pin in 3 places on each side of the face, around the jawline, cheek, and forehead. Also, you need to check for corneal reflex by lightly touching the cornea with cotton wool. To test motor supply, ask the patient to clench their teeth together and feel and observe the bulk and masseter and temporalis muscle. Ask the patient to open their mouth against resistance. Cranial nerve number 7, checking for facial symmetry. Initially inspect the face and note any facial asymmetry including drooping, sagging, or smoothing of normal facial creases. Ask the patient to raise eyebrows, smile showing teeth, frown, and puff out both cheeks. Note asymmetry and difficulty performing these maneuvers.